what I'm going to do is come in at the greater trochanter here. You can feel it right under me. You want to make sure you're not up here on the TFL. My thumbs are going to be like this. So I'm going to kind of sink into the tissue, come up under the greater trochanter, and I'm going to do a posterior to anterior movement this way. So I like to get on a stool because I feel like I can just get a little bit more level and not having to squat so much. Now, you'll know that you're doing it right when you're getting rotation of the leg. Okay? If I'm up here doing it, see the difference? I'm just moving the tissue. So I'm going to get my thumbs under there, good. And then I'm going to see, starting to hit resistance right there, so that's her R1, and then R2 is right there. Okay, so I'm looking to see if she's grimacing, if that's reproducing any of her symptoms. I'm also assessing the quality of movement. Okay, is she really stiff? And you're going to learn what stiff feels like the more bodies you touch, okay? So then I can go in, and let's say that this is her comparable sign, and she's a really acute pain patient. Then I can just start, very gently with an R1, or a grade 1. So I'm staying clear of R1, small amplitude. Grade 2, large amplitude, still out of the resistance. And then as she transitions into that stiffness and out of the pain, then I can do the large amplitude, grade 3, and then grade 4 right at R2, small amplitude. Okay? This one, you want to make sure you're not digging your nails, and you need to use the pads of your thumb so it's not so pokey. Okay? You can also do this in side lying if the patient is really large, but I think you really get under there better in the supine position. Okay? Now, just the opposite of that is an AP. So this one is just a little bit trickier to kind of get on top of, because you have to make sure you're not right over that tissue. So for the PA, you should see internal rotation of the foot and the tibia and the hip if you're doing it right. For the AP, it should be external rotation. Okay, so I'm going to do the same thing. I'm going to find that R1, R2, are you okay? Okay. And then I can do my grades of movement, same way. Okay, but right now I'm really just assessing the quality of movement, looking for reproduction. Make sense? Okay. You guys want to do one more and then practice?
Okay. I have a question with the AP one.
Mm-hmm.
Are you in any way rotating, or are you strictly just anterior, posterior?
Anterior, posterior.
Okay.
But it should, if you're on the greater trochanter, you should see the external rotation happening.